Good day. Thank you for joining me in the second part of this three-part lecture series. As I said in the first lecture, my name is Sinethemba Makanya. So in this lecture, in this conversation, I'll be briefly reflecting on traditional medicine and COVID-19. I'd firstly like to begin by saying that although I refer to traditional healers as traditional healers, I really don't like that term because it doesn't quite do justice to the number of different types of healers that one can get in the South African context. I really won't do justice to explaining the different variations. Rather, I will just speak about the common names that we call healers. We have Isangoma, and traditionally the Sangoma is known as a diviner, as a seer. The Sangoma is well versed in how to communicate with ancestors, as well as rituals in order to mediate with ancestors and to heal different types of illnesses. The Sangoma works with medicine, but the main purpose for the Sangoma working with medicine is on a psycho-spiritual and ecological component of the human. So as I explained before, that the human is a spirit, is a soul, is a body, and traditional medicine interventions or healing interventions work across. So holistically, they work on the human's spirit, the soul, and the body. So a Sangoma, strictly a Sangoma, would then be using medicines in order to work on the human on a spirit and a soul level, sometimes physiological, but that's where the Sangoma's main focus is. The Nyanga is traditionally we know them as a herbalist, although it seems as if the term is shifting. So Inyanga is traditionally a herbalist, and they would use traditional medicine, plant medicine, herbs, for its physiological purposes. So we're thinking about things like high blood pressure, diabetes. If you have a headache, you would go to a Nyanga. If you've got a stomach ache, you would go to an Inyanga. And that's an Inyanga's main purpose. We have what is called uMsunduzi. And although, again, the role of uMsunduzi is shifting, traditionally uMsunduzi is what we call a faith healer. So we know that at some point traditional medicine was outlawed in South Africa, and the only way for our ancestors to carry on working as they work with their own ancestors was then through hiding it within the church, and this is where uMsunduzi came about. It's a lot more complex than that. Obviously, I can't speak about it fully in 5 minutes. Traditional medicines they're exactly that. They're medicine, plant medicines. So this is a tree bark. I don't know if you'll be able to see it. And this tree bark heals a number of physical, spiritual, mental, emotional ailments. This is a herb that we use. Again, it's used to heal physical illnesses, it's used to heal spiritual illnesses, social illnesses, physiological illnesses. This is my own blend that I make for women's health. Mixture of herbs, roots. This is an incense that I make. Again, even though it is for spiritual purposes, really the herbs that are used here are antiseptics and antimicrobials. And what they do is that they clear the air in your home so that you're breathing in clean air. So there's nothing mystical about traditional medicine, and traditional healers are initiated from 6 months to years on how to work with traditional medicines. They would normally have a teacher who would instruct them on certain medicines, who test them if their divination abilities are strong, who help them practice so that they become stronger. There are different types of tests when you're being initiated to be a traditional healer. And it's really a lifelong journey. The idea that our ancestors come and they bring us herbs, again, there's nothing mystical about that. If you look at it through the African cosmological view of reality, which says that we're in constant communication with our ancestors by virtue of human beings being spirit, being body, and being soul. And so briefly, that's what traditional medicine is. Now, unfortunately, the government left us out of conversations about curing and preventing COVID. So just off the top of my head, these different types of herbs that I've shown you target different organs in the body. There are different types of traditional therapies that you use, and these target different centers in the body. So I'm thinking particularly of uGquma. uGquma is steaming. And really in steaming, you're covering yourself, you're inhaling steam, and we can think of what this does for your nasal passages, for your head, for your throat, for your lungs. A lot of the herbs that we prescribe for uGquma are also highly expectorant, so they'll also clear the mucus from your lungs. The same types of herbs are used when we're speaking about uGuphalaza, which is emesis therapy, where you induce vomiting. And here again, the herbs that were prescribed for uGuphalaza are highly expectorant. They cleanse your respiratory system, they cleanse your lungs, they draw out mucus. Now you can already hear the benefits for preventing the spread of COVID. We have izimbiza, which really boost your body's immunity. The main ingredients, at least in the mbizas that I make, are aloe, are fennel leaves, and these are well known in telezi, and these are well known in cleaning out, especially your liver, your kidneys. They're blood cleansers. They really boost your overall health and immunity to disease. So I'm not necessarily saying that traditional healers can cure COVID, although I don't know if any have been given the opportunity to look at how COVID-19 acts and have been given the opportunity to try cure it. I don't know. But I think from what I'm saying, we can already tell that the use of certain traditional medicine and traditional therapies other than uMhlonyane, because a healer would never just prescribe uMhlonyane. Even uMhlonyane is used in conjunction with other herbs. So it's blends, and the different herbs work on different organs in the bodies. But even from the therapies that I'm speaking about, they're about cleansing, they're about boosting, they're about fortifying the body. And all of this we can use as South Africans as we try our best to boost our immunity against not only COVID-19, but a myriad of other diseases. So I say this to say there's nothing mystical about traditional medicine. I'm really saddened by the fact that the government couldn't understand that traditional medicine is holistic, that it will target the body as well as the mental aspects of what COVID-19 and the lockdown could be doing mentally to South Africans. So I'm really hoping that there's more opportunities for engagement on this issue. But yeah, pretty much that's what traditional medicine is. In a nutshell, that's what traditional healers do. Let's demystify, let's use our herbal medicines because they're a lot safer than pharmaceuticals, who actually sometimes leave toxins in our bodies. So thank you for joining me in this lecture. I'll see you next time.